Deadlines for health workers to be fully vaccinated against COVID-19 are quickly approaching in some Canadian provinces. Now, despite the mandate, there are still unvaccinated holdouts in hospitals and in long-term care, which means there could be suspensions, layoffs, and as a result, staffing shortages as early as this week. Heather Yourex-West explains.
Thousands of nurses in Quebec could be off the job by the end of the week as the deadline to be fully vaccinated against COVID-19 quickly approaches.
We decided it was the right thing to do, to suspend the right of practice of nurses who are not adequately protected.
The Quebec Order of Nurses says members who are not fully vaccinated will have their permits to practice suspended on Friday, the deadline set by Quebec's provincial government. The move is expected to impact at least 4,000 of the 80,000 nurses practicing in Quebec.
That's over 5% of the workforce is not vaccinated. That's pretty outrageous.
Montreal nurse Nathan Friedland welcomes the new vaccine mandate, calling it a necessary step in order to protect patients' health.
Where I work, there's a handful, I would say a handful of nurses that aren't vaccinated. I think it's less than 5. Now, are we going to miss those nurses when they get suspended? Yes, but I don't think it will be as bad as people seem to think it will be.
But with the sector already facing staff shortages, the thought of losing any more frontline workers is a big concern.
This is a systemic problem of a long-standing issue in the entire healthcare sector. It's just really come to a head over the last 20 months, and especially now with the vaccine.
In Ontario, hundreds of healthcare workers could soon be off the job too. While there is no province-wide vaccine mandate here, many hospitals have brought in hardline policies, and long-term care staff have until November 15th to get both shots. Deadlines are looming for healthcare workers in the West as well. In BC, workers must be immunized by October 26th, while all Alberta Health Services staff have until October 31st.
The vast majority of nurses are immunized, and they absolutely understand and see that the vaccine is safe and effective.
Alberta's healthcare workers have until Saturday to submit proof of vaccination. AHS says if the policy results in staff shortages, there are contingency plans in place. Heather Yourex-West, Global News, Calgary.
Thousands of Canadians are getting a new life or death reason to get a COVID-19 vaccine. Toronto's University Health Network is requiring all organ transplant patients to be fully vaccinated. The network says the decision is based on data that shows unvaccinated patients face higher risk of organ rejection as well as death from COVID-19. Now, it's a first in Canada policy, but is it ethical? Morganne Campbell explains.
I won't live without a transplant.
Darlene Van Wyck is suffering from non-alcoholic fatty liver disease and is one of about 1,600 people in Ontario waiting for a life-saving organ. Canada's largest transplant hospital has implemented a policy requiring patients to be fully vaccinated against COVID-19 before they can be eligible for a transplant. According to a statement released by the Ajmara Transplant Center at the University Health Network, the team says the policy is needed since transplant recipients have high health care needs post-transplant. Unvaccinated recipients would also pose a greater risk of spreading illness to other immunocompromised patients they may have contact with in inpatient or ambulatory care settings. The move in Ontario has led to backlash online, prompting some to revoke their donor status, calling the policy discriminatory. Similar policies are in place south of the border.
Vaccination requirements work, and there's nothing new about them.
Last week, a Colorado woman waiting for a kidney transplant was bumped from an organ transplant wait list for not getting vaccinated.
I'm being coerced into making a decision that is one I'm not comfortable making right now in order to live.
But UHN isn't wavering in its decision, as transplant programs already follow strict criteria. For example, if someone needs a lung transplant, they cannot smoke. If they need a liver, they cannot drink. It is a small price to pay for someone like Van Wyck.
You have a good day, you're feeling better, you think, okay, everything's going to work out. And then you have days where you're planning your funeral and you're thinking, you know, you may not get that transplant time.
UHN says exceptions to the policy may apply for those with medical reasons or in cases of an urgent need for a transplant. Morganne Campbell, Global News, Toronto.